It is 204th day of heroic struggle of Ukraine. Here is Natalia Staroprava, and we're about to continue the series of briefings in Mediacentru Ukraine. In Lviv, there is the Advisory and Coordination Center for IDPs working, who are the first of their breed in Ukraine. And I would like to ask toward Halyna Bordun, the advisor of the head of Lviv Oblast military administration. Please tell us about the coordination of this center. Hello everyone, Lviv region is one of those little oblasts that can talk about advisory and coordination center help. This is the service that provided from the first day of war, starting from the train station, that 24/7 meets all the buses and trains coming from the eastern Ukraine, where the volunteers and psychological workers work. They provide medical, psychological, health services. They escort people and escort them to the following counties of Lviv. Lviv Regional Administration has worked through the next line of services that would give the ability to coordinate the activity of the Lviv region. From the last week, the advisory and coordination centers they are there in everywhere in Lviv region. In Lviv region, there is 3 of them in Peremyshlan, Kamenka-Buzka county, as well as Gorodok town. Tambir, Yavoriv, Chervonograd, Drogobych, Zolochiv. These are the counties, and 3. These are the counties already and working these days. What does it mean for every person who comes to Lviv region? First of all, we united from Lviv military administration, 28 partners of volunteering funds and non-government organization and international organization who coordinate their centers and send their psychological workers and judicial workers who, besides the psychological help, also provide the addressing help and address the needs of IDPs. How is it possible to understand how to get there? There is the phone number, that is the contact center phone, it's 112. That is the Lviv military administration contact that will help you to find the advisory and coordination center in those towns listed by me. In each of these towns, there is a graphic created together with the partners. Usually it works from 10 to 5 o'clock working hours, and in each of them there is a military administration representative is there every day who basically coordinates and sends them to judicial workers and psychological workers. It is extremely important that today, since we are talking about the evacuation of the east of Ukraine for people who during the summertime found the shelter in different summer cottage towns and buildings with the help of different organizations and just in different non-indifferent people, it is important for them to receive the help when it comes to winter time. There is a warmers and warm clothes. And today, when we learned about different shelters that are here in Lviv region who need our help, that is why we invite how you can coordinate with us. You can basically physically come to our address while by contacting 112 number, or by coming directly to one of the administration buildings who can guide you and tell you the telephone and phone number. Number 3, service number 3 is a working group that includes the key departments involved into the process of helping the IDPs. These are the Department of Education, Social Welfare Department, Healthcare Department, Culture Department, as well as the partners. There is a psychological help for Ukraine organization, Sheptitskoho Clinic. And these are the partners that are working together in order to unite to provide the big and total help for IDPs and military personnel. We have designed 3 main directions. These are the coordinations of 3 important topics. This is the topics first, how to talk to children and their parents about the war, how to help parents to communicate with their children and what one needs to know about that. This is the topic of how to react and work and do during the alarm system. Another service that we provide is the partners who united and go to all the possible shelters in Lviv region with providing medical help and primary medical help. When it comes to coordination of work of psychological services, I think Orest Suvalo is the first one to address it. But I would like to say that in September, we together with the Ukrainian Catholic University and other partners, for those practical psychological and social workers who are mostly involved today in the help of IDPs, we conducted kind of strategical training with them of how to work as psychologists under the crisis circumstances. And today we are guiding the psychologists on those three headings and those three topics that we highlighted. We understand that there may be changes due to the changes on the front line. Thank you. I would like to address the work toward Roman Andres, the acting director of the Social Welfare Department. Can you please tell us how many new IDPs live in the region and what is their number? Well, thank you. We have one general state register of balance of IDPs. In accordance with this register, right now in Lviv region, we have more than 250,000 IDPs. 160,000 are women and 90,000 are children. We have more than 75,000 children. Also, we have more than 32,000 pensioners on retirees. And I would like to stop to do a pause here, since the aged people and physically incapable people had to be evacuated to our region, and a lot of them stayed there, are here by themselves, and they need special help. Sometimes this is the people who have limited physical capabilities, who are laid up or have lower possibilities to move. We have 14 establishments, 11 psychology and neurological hospitals who provide this help for these people. Also, I want to give another thank you to religious organizations who give us strong support in this situation. A huge amount of people who can avoid 24/7 care. It goes to religious organizations. Together, having combined our forces, we managed to hold the situations that allow us to talk, that those people who need this help are receiving this help. Also, I want to emphasize another factor. On the east and on the south of our country, there is a huge need of evacuation. The whole establishments, especially in the Lviv region, right now there are the representatives of 8 of these establishments, and we see, in accordance with information that we receive, especially in the foreseeable future of colds that are coming and winters are coming, the number of these people increases. And the work we are doing right now is the work heading towards improving of living conditions and providing social welfare services to those people who are already in Lviv, as well as to increase the capabilities of our establishments in order to increase the capabilities to take more people in. And the last group of people who we received, that was on Saturday, these were people from Zaporizhia Oblast, and right now they live in one of our establishments. We are thankful, first of all, for the work done by increasing the number of places. And this work started on the 24th. Thank you to those our administration leaders and our establishment leaders. And also a special thank you to NGOs and international non-governmental organizations who helped us and provided the base level of those needs that we needed immediately. Thank you. And when it comes to our work being put together, we can immediately see the result that makes us hold the situation on the necessary level. I would like to address to Orest Suvalo, a member of the Medical and Psychosocial Support Working Group, coordinator of Mental Health for Ukraine project. Can you please tell us about how this coordination center works and what requests do you see? Well, my responsibilities is the coordination of psychological help, because it's not boiled down only to psychological. This is the psychological and social support, and we invite people to join this advisory and coordination group, because coordination of work between many organizations, this is exactly what we need right now in conjunction with the escalation In Lviv region, there is many international organizations who provide help when it comes to psychological help, and the creating of this kind of centers in Lviv area increases the chances of providing the better help of this type. And the task of this advisory and coordination center basically is to provide information where people can receive information about different services and help that can be provided. So the psychological help and psychological and social help is an important aspect existing within the warfare borders, because without meeting the base needs when it comes to living conditions, food, it is extremely help to provide this kind of help. Also, we need to not forget that there is an autumn coming. We have a lot of anticipated things, and this kind of feeling of anxiety also exists. That is why when it comes to autumn, this is also the sharpening of the health conditions of people. That is why the initiative of creating these advisory and coordination centers is a good way in order to make one step closer to people, since we know that there are some services provided in the counties, and also this is another way of integrating of people who have just came to our county in accordance with their needs. More about the team of this center. Who are the people who agree to work there? You have already mentioned about the international organizations. Can you talk about like more wider about that? Now, as I know, there is a memorandum written between 28 international organizations, and they all communicate with the Advisory and Coordination Center. When it comes to psychologists, we have a schedule formed, and those specialist psychologists who are the representatives of international organizations, they form their time and schedule when these or that psychologists can provide psychological help in this or that town. Also, we see, judging by the results of polling, the number of percentage of those people who need crisis psychological help or psychological consultation in accordance with their needs, they are sent to the specialist or to the senior specialist, for example, when it comes to psychological help request. So more than half a year, the IDPs in Ukraine, some of them live in Lviv. How did their request change? What do they need mostly this time? Well, from the point of view of psychological help, I can tell that we are going through the second or third phase. We all know that the stress reaction has three phases. First one is strangling, another one, and the third one is exhaustion. Right now we are on this phase number 2. The Minister of Health of Ukraine published the polling where you can see that there are still resources among the people, and people see that the level of welfare is gives hope. But this way or another, our resources are also have ends. That is why we have to know where we can find for help, not to be afraid to ask for this help, because especially when it comes to evacuation, and this way or another, our resources also slowly coming to an end. That is why the best way is to find the help from other organizations. So, in brief, when it comes to categories of people we see, and starting from the coming to the railway station March, this is the time when there was a huge psychological service provided, and today the need for psychological help has increased, and in our counties we coordinate psychological help provided to people accordingly, and the needs of people who are registered in online format. These mostly are the requests for warm clothes, for warmers, for generators. And if you mentioned that NGOs, there are NGOs who gave shelter to 25, 30 people, and right now they ask for help to help these people to go through winter. And also the resources of people come to an end, and there is a huge need of food, because during the summertime we have vegetables, we have fruits. It's easier. When it comes to winter, it's harder to do. That's why when it comes to this, we also are addressing these problems and coordinating these efforts with international organizations. During the last night at the train station, we saw that the number of requests for those people coming to Lviv increased when it comes to warm clothes, especially for children. And those categories of people who are disabled or have some physical problems, we also provided. So any procedures written in any organizations, we register and coordinate all IDPs for the schedule of meeting with our representatives. In one of the centers, there can be working for the judicial workers from different organizations as well as the psychological workers. Our task right now is to inform as maximum as possible. Our aim was that before that it used to be only Lviv, mostly as a main center of providing help. Right now we are concentrating of every town in Lviv region to be able to provide this kind of help. If there is a need, the international from the shelters, international partners go to the shelter and register all the necessary needs that this shelter requires. And every shelter is facing the situation when 10 or 15 people daily are registering there. And we can see that people are mostly concentrated and living there in groups. Lviv region is getting ready for a new wave of IDPs, as well as we are getting ready to winter times when the heating season should be switched on. How does Lviv region get ready for this? And what are the challenges Lviv region is facing? Well, truth be told, the wave of people who will come to Lviv, it is hard to prognose or do the broadcast in numbers. Right now, what we are doing, we are doing the reparational work for those buildings that have the high level of readiness. Mostly these are the dormitories. And these are the buildings that within the minimum time and minimum finances can provide shelter and a roof above the heads of IDPs. Also, I want to tell that taking into account that in Lviv region, even before that, we have the huge touristical potential. We are a touristic region. We still have many places where in the pre-war time, lots of people used to come to. And we see a huge percentage of people who, after coming together after the evacuation and understanding that they are in relatively safe environment, they switched their life from wartime to kind of normal time, and they're coming back to private sector. Thank you so much. I want to remind you that Halyna Bordun, the advisor of the head of Lviv Oblast Military Administration, Roman Anders, the acting director of Social Welfare Department, and Orest Suvalo, a member of the Medical and Psychosocial Support Working Group, coordinator of Mental Health for Ukraine project, were with us. Thank you all for this meeting, for this talk. I want to remind that in 10 minutes we have another briefing. That is why stay with us and stay